Hi, I'm Dr. Andrew Plummer with Spark Eye Care. Today I want to talk about presbyopia, one of the most common and predictable parts of aging. Most people notice it sometime in their early to mid-40s. You may find yourself holding your phone farther away, needing brighter light to read, or reaching for reading glasses for the first time. In fact, presbyopia is probably the most predictable sign of aging. Wrinkles and gray hair show up at different times for different people, but presbyopia almost always starts between ages 40 and 45. So what's actually happening inside the eye? When we're young, the natural lens inside the eye is soft and flexible. It can change shape to focus on things up close. This process is called accommodation. When you look at something far away, the lens is relatively flat. When you look at something up close, the lens becomes more rounded to increase its focusing power. As we age, that natural lens gradually becomes stiffer. It loses its ability to change shape. As a result, it becomes harder to focus on near objects. That's why most people eventually need reading glasses. For many years, reading glasses were really the only practical solution. But over the past decade, there has been a growing interest in presbyopia-correcting surgery, especially for people over age 50 who prefer not to rely on readers. This has become more popular as the safety and precision of lens-based surgery have improved dramatically. One option is something called clear lens exchange. This is very similar to cataract surgery, but it's done before a cataract becomes visually significant. In this procedure, we remove the natural lens and replace it with an artificial lens implant called an intraocular lens, or IOL. Some of these lenses are designed to provide vision at multiple distances, which can reduce or even eliminate the need for reading glasses. Modern IOL technology has advanced quite a bit. Today's lenses can provide a broader range of vision and more natural visual quality than earlier designs. However, these lenses are not perfect and they're not right for everyone. Some patients may notice halos or glare at night, others may still need glasses for certain tasks, and as with any surgery, there are risks that need to be carefully considered. That's why the most important step is a detailed consultation, where we look at your eyes, your visual goals, and your daily activities. For the right patient, presbyopia-correcting surgery can be life-changing, but it works best when expectations are realistic and the lens choice is tailored to the individual. If you're over 50 and finding that reading glasses are becoming a daily frustration, it may be worth having a conversation about your options. At Spark Eye Care, we're always happy to walk you through the pros and cons and help you decide what makes the most sense for your vision and your lifestyle. Thanks for watching.